Welcome everybody to this session where we're going to look at the need to manage occupational health and safety inclusively and taking practical steps to make sure that every worker in your organisation is protected. Before we get going, I'm going to just give you a little bit of housekeeping information. This is a listen-only webinar. It's being recorded, but we welcome your questions via the Q&A function. Please do send us questions. We'd like this to be interactive. We really want to know what you think and what you want to know. We'll answer those questions throughout the webinar. Don't wait till the end. Also, use the Q&A function if you're having any technical difficulties, and our team will help you. Just to let you know, this is CPD recognised, so do request your certificate via the feedback survey after the event. And just to let you know that the slides will be shared with you, and there will also be a link to a recording of the event which anybody can watch. Okay, let's make a start. I am Sally Swingewood. I work for BSI, the UK standards body, and I'm also the committee manager for the ISO Technical Committee on Occupational Health and Safety. And some of my colleagues from that committee are joining us today, as well as some people who are not part of the committee. So I would like to ask everybody to turn their webcams on now, please, and introduce yourselves. Mike, you popped up first, so would you like to begin? Would you like to introduce yourself?
Yes, thank you, Sally. My name is Michael Seymour. I have been on TC 283, the 45,001 committee, since 2013, and I am one of the two small business representatives doing our best to make sure that small businesses are not forgotten in occupational safety and health management.
Thanks, Mike. It's good to have you here. Anne, please.
Good afternoon, Sally. My name's Anne Mallory, and I'm a director of Mallory Health and Safety Consultants Limited. I'm an independent consultant with some 20+ years experience. I work across a great variety of industry sectors: civil nuclear, construction, service industries, the waste industry, and I've worked with small family businesses right up to FTSE 100 companies. Thank you.
Thank you, Anne. Elizabeth, please.
Hi everyone, Elizabeth O'Farrell here. I work with the National Standards Authority of Ireland, NSAI, as a standards expert, and I've been involved in occupational health and safety management system standards for over 20 years, first with 18,001 and then with 45,001. I also am responsible here in NSAI to ensure that standards that are developed are taking into account the diversity of the human population, including older persons and persons with disabilities. Thank you.
Thanks, Elizabeth. And finally, Nick, please.
Hi there, everyone. My name is Nick Wilson of Talk Mental Health. I'm a speaker and campaigner for men's mental health and disability, with experience, lived experience with mental and physical disabilities myself, and have been more and more involved with accessibility, inclusion and mental health within the workplace over the past 5 years.
It's brilliant to have you here, Nick. Thank you very much. I'm aware you need to step aside for a moment, so please do, and come back when you can. And we'll catch up with you as soon as you're back. Thanks, Nick. I'm talking away on mute again, aren't I? It's just typical. So let's move on to the next slide, please. So, very basic question for our theme today. Why is inclusivity in OH&S management an issue? I mean, Elizabeth, aren't the standards we write already including everyone? especially ISO 45001, which is the management system standard, it's generic. So what's the problem? Now you're on mute.
That's it, we're even now. So management system standards, Sally, are generally written in a generic form to be broad and relevant to as many organizations or people or products as possible. The standards, unfortunately, standards then may not have enough information to support an organization to understand what is meant by diversity and inclusion. And they may intentionally or unintentionally exclude a number of persons and their needs. And I think if we looked at 45,001, we could see that there was a really good attempt using language about the needs and expectations of workers and other interested parties, and how that was to be addressed. But I think in order to assist organizations to take into account the diversity of their workers, standardizers need to be more descriptive in their use of language to help understand what is actually meant by all workers and so on. Thanks.
Yeah, thanks, Elizabeth. And we will talk more about this as we go through the session, but that's a really good overview. Nick, you said you have lived experience, and you talk to a lot of organisations and share your own story. Perhaps you want to briefly do a bit of that now and tell us why you think we need to focus on improving inclusivity in health and safety management at work.
I was hoping I was going to get the easier questions.
Later, you get easy later.
Oh, I see. Okay, that's all right. Yeah, I've been involved in mental health a lot for the past decade, really, and seen how the army were really rubbish at inclusivity. They didn't even know, they did nothing around mental health and things like that. And then so since I've been doing more mental health training with the workplace, and it isn't until you go through your own mental illness journey, you then realize how workplaces really aren't set up for people who've got mental illness. Focusing on that specifically at the moment, and if you look at your return to work procedures, for example, they're massively set up for someone who's broken an arm or a leg or been off of something physical. But when you're talking about a phased return to work of a week, when you've got someone who's maybe recovering from depression and anxiety, it just isn't set up right that way. More recently, since being reliant on a wheelchair as I am now, hence why I'm not just being a lazy person being on my bed here, by the way. I've got a physical disability. I've got a spinal injury, which results in massive chronic pain. And since being in my wheelchair and going out into workplaces or trying to, it isn't until you actually sit in a wheelchair when you really see how bad things are in places around the UK. And even the NHS is starting to involve more people with lived experience. And they are being heavily involved all the way up to strategic level of learning from their experiences, because there's great value in speaking to people who live with this, be it mental illness or disability, every day. And the best way that we can help other people is to understand when there's a change of character in them, because that's when we know that's a massive symptom for something's not right. And as a society, we've kind of lost that ability to get to know one another. So something like this coming out is kind of really supporting that that mindset of truly including everybody and being very aware of what people might be going through. So anything that works down the inclusivity way for both physical and mental is, in my mind, extremely important. But I do feel there's a long way to go. But this ISO is a massive starting point for it for sure.
And when you talk about this ISO, you're talking about ISO 45003, correct?
Yes, sorry, yeah.
That's all right, just to clarify for everybody. So 45003, for anybody who doesn't know, is the first global standard on psychological health and safety at work and well-being. It's free to read on the ISO website, so I would encourage everybody to go and have a look if you haven't seen it yet, as well as being available through your national standards body. But we thought it was very, very important that cost was not a barrier to people looking at this standard, so ISO agreed to make it available in read-only form on their website, so do take a look. It's under the COVID-19 page. Okay, thank you for that, Nick. I want to turn to Mike now, just briefly, because again, we will talk more about it as we go along. But in terms of catering to our small businesses, which, as we know, are what, over 95% of businesses in the world, how are we doing and what should we be doing?
Thank you for that question, Sally. First, I think we need to understand and appreciate the magnitude of the problem. Globally, there are approximately 400 million small businesses. And as you say, they account for 95% of organizations around the world. And they employ 60 to 70% of the workers around the world. In many ways, the small and medium enterprises form the foundation for the world economy. Now, every year, more than 2 million workers perish as a result of work-related incidents and illnesses. So the outsized role of SMEs in the world economy and the number of workers they employ justify, and in my mind, mandate special attention. Thank you.
Thanks, Mike. I'm going to turn to you, Anne, now. I met you through the UK regulators' roundtable initiative to reduce business burdens. And we were talking about business burdens on small businesses. What are your thoughts on how we can reduce burdens without lowering the levels of protection in occupational health and safety? What ideas would you bring to that?
Thank you for that, Sally. My small businesses have a major criticism, and that's certification bodies. And by that, I mean not just trade associations like NICEIC, but also supply chain and contractor vetting organisations. So you have SSIP, Achilles, Safe Contractor, CHAS, Construction Line, and so on. And the problem for many of them is that there's a somewhat arbitrary rule in law about the less than 5 employees and plus 5 employees. And what this leads to is there's a big difference between 0 to 5 employees, 5 to 10 employees, 10 to 20, 300, 3,000 multi-site operations. Yet this bar seems to hit at a relatively low determination. So one of the problems is that, to my mind, contractors fall into a lot more regulation the moment they operate out of premises, because they have occupier liability and all of facilities management. Yet there's this kind of artificial bar within the accreditation process. And these certification bodies, some of them do try to put in a level, but you find that small organisations are often measured against BP, and there's this sort of creation of bureaucracy where there should really be a focus for the small organisations, I believe, on training individuals and supervision. But all of this is driven by procurement processes, and I think we should encourage clients to be intelligent customers and look at what they're procuring, because there's a very big difference between wanting somebody to come in, for example, and service a gas boiler. You need that individual certificate right the way up to perhaps a company engaged to build an office block. You want to make sure they have the management systems. Yet I very often find that clients push everybody through the same mincer, and it's this classic one size fits no one. So I would like the certification bodies to look very closely at how they categorize, particularly the small contractors, and for clients to perhaps have more intelligent procurement processes, so that truly reflects the health and safety and the real risks faced by people working on the front line.
Thanks, Anne. And we will come back a little bit later, Mike, to the efforts that the initiatives the technical committee are taking to try and address this, because I do think what we're hearing is if the standards community can provide a different route for those smaller or lower risk organisations, it's not always the numbers that matter, it's the hazards and the risks that they're facing, then that might help change the conversation in the supply chain and in certification bodies. Not that we have an instant solution, so please don't hold your breath, but it is something that we are looking at. If we can move on, please. So now I want us to discuss a little bit more about the benefits of focusing on equity, diversity and inclusivity when managing occupational health and safety. And Mike, there's a lot of evidence now that diversity brings success to businesses. Is consideration of diversity in health and safety part of this, or is it still sort of siloed off?
Well, Sally, thank you. That's a very interesting question. I think there is a lot of evidence building that bringing diversity brings success to businesses. In the context of occupational health and safety management systems, evidence gathered over the years strongly suggests that organizations that have OH&S management systems, even the small ones, the large and small alike, experience reduced operating costs, lower turnover, increased worker morale, and improved business reputation. These are important factors, and their dollars are associated with each of those. So including all workers is a core value that drives the effectiveness of occupational health and safety management systems. Emphasis there on the word all. So a new study by the Harvard University that is scheduled to be published shortly, it's not currently been published, shows that US organizations with certified OH&S management systems have 20% fewer injury and illness cases. 20% is a huge number. Let me give you an example. Applying that 20% number to the estimated 2 million worker fatalities that I mentioned earlier suggests that universal implementation of OH&S management systems could save 400,000 lives every year. I think that's a huge justification for making sure that occupational health and safety management systems are accessible to all organizations and accessible to all workers.
Yeah, that's quite a sobering statistic, isn't it? So we've been hearing a lot recently about the worldwide COVID fatality numbers, and you can think about that. If we did things differently and saved 20% of those people, it's huge across the world. They're massive numbers.
Absolutely, absolutely.
Elizabeth, can we talk a little bit about equity? It's a word that people don't always fully understand. They mix equity with equality, and what does it mean in this context, and why does it matter?
Yes, Sally, you're quite right. A lot of people mix it up and I guess have different understandings of it. And equity really refers to fairness and justice, and it is distinguished from equality. And traditionally, equity in the workplace brought to mind equal pay and fairness of pay. And of course, this is a very important issue in itself. But in the context of occupational health and safety and having workplace equity, it's about ensuring that the needs of all workers are taken into account, especially those that are traditionally excluded. And we can talk about persons with disabilities, older persons, demographics such as ethnicity, race, gender, and gender equity. And equity focuses more on providing resources proportionally to achieve a fair outcome for these employees. So, for example, access to education, access to promotion, and learning and development opportunities, for example, in carrying out occupational health and safety audits, involvement in health and safety committees, being involved in the risk assessment. So if we have the diversity of people in the workplace, in the workforce, then ensuring the needs of all workers are taken into account, we apply the equity in this area. Thanks, Hallie.
Thank you, Elizabeth. Anne, can you tell us about any of the organisations you work with where you've seen them working on this inclusivity, this equity in their occupational health and safety management and getting benefits from it? Is this anything you've experienced in your work?
Well, yes, I have a particular client that embraced mental first aider training. And this had some really quite interesting results as people put their names forward and became involved in the process. And post-pandemic, I think it was quite a surprise to discover the levels of anxiety for those returning to the workplace, particularly the idea of being in close proximity to co-workers and so on. And through the sort of sessions that encourage people to put their name forward, it actually created an atmosphere where people were able to explain some of the reasons why they were worried about coming back to work, concerns about members of their families who might be vulnerable. And although this was under the mental health first aider training, the actual meetings and communication had a massive knock-on effect, even to the point where it actually had an influence in terms of design. This particular organisation began to look at the design of their laboratories to have full-length glazing panels segregated from office areas where people could look at things like occupancy, design of desk areas to give space, which is very, very different from the sort of ethic we had a number of years ago about getting as many people as you possibly could into an office space. So it's actually created design considerations going forward. And I think the engagement that rolled out from the mental health first aider training has led to the creation of working groups looking at mental health in the workplace, which is really quite a positive result, I feel. Thanks, Sally.
Yeah, absolutely. And engagement, of course, is absolutely key. It's critical to all of the work we do in the technical committee. It's at the heart of all of our standards. And Nick, I wanted to come to you because equity, diversity and inclusivity is a really hot topic right now. And perhaps the one good thing that came out of COVID, but we are talking about these things. We are talking about mental health. We're recognizing that, oh, actually it does matter. And actually it does impact work and you can't just pretend it doesn't. But do you think there's an issue here? Do you think it could be one of those flash in the pan moments where it's the popular subject of the day and then it all drifts away again?
Yeah, thanks for that. Yes, in a short answer, I think it is. You know, I've been involved in it in the past 10 years, and looking at pre-COVID, it was starting to do more within the workplace. They were starting to do more and more in it. Anne brought up a brilliant point about mental health first aiders, which in my personal opinion, too many workplaces saw that as a silver bullet, and that was it. Let's just train everybody in MHFA, but then didn't implement it correctly, didn't have any aftercare support for those who are suddenly being in MHFA. And as I'm a trainer in it, and I could see how it was implemented incorrectly. It's a good tool as part of a bag of tools, if you like, and a good part of a strategy. But the only way to really approach mental health in the workplace, or mental ill health in the workplace, has to be a full from the top down and from the bottom up, and it has to be all the way back to the culture of your organization, and the full structure of the workplace needs to be looked at. There is no one size fits all, because one of the unique issues with mental ill health is that it's completely individual. So you can't compare me with another me who've both got depression, for example, because we will both display different symptoms. So it's extremely difficult, and like anything in business, when it becomes more complicated, it tends to be more expensive, which can be very off-putting almost from it. Will it close down even more? I think one of, like I say, the big silver lining of COVID is it's absolutely there. More people who weren't aware of mental ill health pre-COVID experienced it during the past 2 years. And I think it's things like, again, ISO 54003 coming out, and the work that you do here, which will keep on at businesses. And I think it's on all of us as individuals, professionals, and personally, to continue the pressure, to continue campaigning and pushing forward for much better workplaces and environments which really care for and put their employees first.
Thanks, Nick. And I think you've just touched on a really good point on possibly why we're talking about EDI today. Psychological health, well-being affects every single person on the planet, good or bad, whatever your health is like. It's like physical health. Sometimes we feel well, sometimes we don't feel so well. It's exactly the same when we're talking about psychological health and well-being. And it's that diversity point, isn't it? It's that we are all individuals. It isn't one size fits all, and that leads us very neatly to the next slide. If we can move on, David, please. So why is it so hard to use a one size fits all? It's like you'd seen the slides before, Nick. What can I say? You know, and I think I'd like to stay with you for a moment, Nick. You know, you have a personal situation where it's not just about your mental health, it's your physical health as well. You're a complex human being. As a worker, whether you're self-employed or working for somebody, you have complicated needs that are not the same as Elizabeth's needs, which doesn't mean that Elizabeth doesn't have needs, but they're different.
I am a complex case. I'll accept that. So mine maybe isn't the most generic one to kind of go through, but even if we just look at mental health generally, it comes back down to, all the time, comes back down to how we are individuals, and therefore mental health and how we respond to it and how it impacts us is completely individual. And when you try to, for example, when the NHS were solely concentrating on cognitive behavioural therapy, that was the only therapy that you could get, it wasn't massively effective, because that was a one size fits all. Now, when we look at mental health training and we look at individuals and we look at how you can best support people, you need to put trust in listening to what the individual tells you, because it's not your place as an employer, as a HR manager, etc. It's not your place to say what they should or shouldn't be doing, really, because it's them. You know, you can't really do that. And so, how do you then make it so you have one support system that suits everybody? And that is where the real complications come in. But that is where I would say you need to build, you need to include the employees. If you've got someone who's struggling with poor mental well-being, mental ill health, opposed to a diagnosed illness, then, you know, speak to them, see what is best for them, see what kind of thing they need to do, put together a care plan that is working with them. And it's all about the right support, the right communication that is person-centered. And trying to do that is extremely difficult, which puts a lot of employers and businesses off, doesn't it? You know, because it's so unique. But again, if you go look back to the structure of the organization and the culture, if you're having a really inclusive, supportive culture where all employees are respected and really feel like they're wanted by the employer and they're supported, then you're not going to have so much one size fits all support.
Yeah, thanks for that, Nick. And I think it's worth just reminding our attendees today that even before the pandemic, psychological ill health was costing organisations far more than physical ill health. And that's only getting worse. And it was getting worse before the pandemic. So goodness only knows what the pandemic has done to those statistics, apart from the flip side, of course, as I already mentioned. At least some organisations are now listening. But, you know, we're talking a lot about it, but that's because it is foundational, isn't it? Nick, you wanted to add something?
Yeah, just to say the figures, the specific figures we're looking at to the UK economy pre-COVID, bear in mind, was 110 billion pounds a year is the cost to the UK economy due to mental ill health. And that was pre-COVID, and we still haven't seen the full impact of the past 2 years on people's mental health. We haven't seen the full thing.
Absolutely. So let's switch tack slightly now. Elizabeth, you're a very experienced standards developer. You were involved in the drafting of 14001 and its predecessor standard. Management system standards are designed to be generic. It actually says this is a generic standard. It's designed for everybody. Has your view on how we make sure every worker is included changed over the years, and why?
Yes, Sally. So yes, this is a generic standard. We all know the history of our generic standards came out of quality management systems, and that's organizations were using management system standards to improve the quality of the product or service that they provide to the market. But this is a management system standards about protecting the occupational health and safety of the workers. So I think the MSS, as we call it, the management system structure, was a really good starting point, and I think it was a really great opportunity to use it to evolve 45001. But now is the time we have a great opportunity to move to the second set of the steps on the ladder and look about, well, how is that going to be revised to take into account the diversity and inclusion of the workforce? And how are we going to use the information we have now, the research we have now, to evolve the standard to take into account all the workers? And I think it's interesting to see that we have, for example, ISOPAS 45005 has started to use more inclusive language in their standard. And ISO 30415, a human resource standard, has acknowledged when they wrote the standard on diversity and inclusion, you know, the language is much more open and useful, and helping organizations understand the human population and how we are all different. It's interesting to hear you say, Sally, there, you know, that we are all different. We have all different needs and expectations, and one size, and I think we've all acknowledged, one size does not fit all. And it definitely doesn't work for me, and I'm sure it doesn't work for Nick or Mike either, or Hans. So I think this is a great opportunity for us to move to the next stage and focus on what is this standard really about. It's about the health and safety of the workers, and how do we help organizations understand what that really means. Thanks.
Thanks, Elizabeth. And, you know, I think it is quite exciting in terms of developing standards. 45005 that you mentioned is the guidance that the technical committee produced on working safely during the COVID-19 pandemic. Again, that's another free to read standard if anybody would like to look at it from the ISO website. I would encourage you to do so. But standards are one thing, right? And revising these standards to improve the language, it's going to take time. It's not going to happen overnight, however much we're encouraging our awareness and building our awareness and taking initiatives to try and help. We need to look after workers today with the documents we've got. Anne, what would you like to see being done differently? What would you like to see being done differently in organisations? What would you like experts in the technical committee or the HSE or the other regulators in other parts of the world doing?
Forgive me, Sally, if I take this back to something very, very simple. One of the big problems with a lot of standards is they are document driven. Automatically, we exclude people with literacy issues, people with sight issues. I would very much like standards organisations to consider other methods of communication. It is a point I made to the HSE on their business burdens about trying to put forward information by different means. I also think I would like to see examples of simple compliance. We very often see very complex and detailed information about what compliance looks like for big organisations, and the point has been very well made by Mike about how many small organisations are out there. And I feel if the guidance could be tailored to give examples of clear, simple compliance, it would be very helpful. I know within the regulations we do have a few examples of this, like the construction regulations as a simple construction phase plan, and also there's a very complex construction phase plan. Clients tend to default to the most complex one. So I'd very much like to see simpler language, other mechanisms of communication, understanding that the people at the front line sometimes aren't the best at academic paperwork, yet we persist in writing these reams and reams of method statements and risk assessments that are all document driven. We don't think about the end user. So that would be my idea, to make things more inclusive and to move away from one standard approach that doesn't address the different sizes of organisations and who ultimately the end user is. Thank you, Sally.
Well, don't thank me too soon, because I'm going to come back to each of you before the end of the session and say, give us a practical tip that organisations can take away today so that they can manage health and safety more inclusively from this moment on, whilst we are trying to get it right with our standards. Don't hide, Nick, I'm coming to you too. So have a think about that. I'm not asking you yet, but let it percolate in your brain. And just for our non-UK audience, the HSE is the UK Health and Safety Executive, the regulator in the UK. So Mike, we are taking some steps in the technical committee to look at these things that Anne has talked about. And we have just approved the formation of a new task group to explore different ways we can support small businesses. We've also got people explicitly looking at inclusivity in our language generally. Do you think it's possible to write a single management system standard that effectively speaks to large and complex organisations and that four-person organisation working from home?
Well, that is the crux of the question when it comes to small organizations, Sally. To answer your question directly, I am doubtful that we could ever write a truly generic and truly applicable standard to all organizations. One of the remits of the organization of the task group that you just mentioned within TC 283 is to explore the viability of the idea of having a separate standard that's more appropriate for small organizations, more easily understood by small organizations. I want to thank Anne for what she just said about making sure that we keep the end user in mind. It's something that we don't always do a good job at, and I think it's absolutely a key to success is to always have your feet in the end user's shoes while we're writing these standards. I believe that the key to success in writing these standards is to understand the variety of conditions and perspectives and needs and expectations of all types of organizations and their workers, all of their workers. So I don't believe that the one size fits all approach it does present challenges because it's difficult to account for the incredible differences among organizations and the endless variety of workers. It's probably not possible to write enough words to encompass those differences.
Well, I want us to move towards the more practical again. I mean, we're talking about standards development, but I think what our attendees want to know is what should I be looking for? Who is it that I might be missing out of my health and safety management? So I'd like us to think about that now and think about some examples of the types of workers who perhaps fall through the cracks of this generic approach. Our traditional working models are changing. We have this thing called the gig economy where you only get paid when you work, for example. We have the Ubers of the world. Mike, do you think this is a problem? Are these people being left behind?
Absolutely, Sally. Gig economy is a word that I'm going to use here because it's really, really important. Our traditional working models are changing, and they're changing quickly and dramatically, and this is a problem. We're talking about the independent contractors and the gig economy. It's unclear who has the responsibility for ensuring their health and safety, and that lack of clarity is dangerous. One other group that I'm particularly worried about in the context of the pandemic, but also otherwise, are volunteers that are often overlooked, but almost always present. Think about healthcare for a moment, where volunteers are almost always present. And in the pandemic, volunteers are often assigned the reception desk, the very first person in a hospital or a clinic to interact with the public and face the risks associated with COVID or any other communicable disease that might bring into that environment. So it's important that we deal with all of the workers, whether they're traditional employees on the HR payroll or volunteers or gig workers, independent contractors. It's important that we think about occupational health and safety and its impact and its benefit for all of those groups of workers.
So a little reminder to everybody on the call that your workers aren't necessarily just the people you pay or necessarily the people you see. Yeah, it's bigger than that. And I know Elizabeth will remember the very long discussions when we were developing ISO 45001 on the definition of what a worker was. And it includes all of these people, but we still, in our generic approach, go for the majority, go for the most obvious group rather than the nuance, the diversity. And one of the things that I'd also like us to explore a little bit is less traditional industries that perhaps didn't have an immediate occupational health and safety focus because hazards aren't so obvious. You've mentioned working in the nuclear industry. There is obvious hazards there. And I imagine, you know, health and safety has always been a priority, particularly safety. But what about service industry? What about small startup tech companies? What about the retail industry? What about hospitality? Are we looking after workers in those sectors well enough, or are they getting left behind?
Well, I completely concur with what Mike has said. I think there are many, many hidden workers, for example, contract cleaners who go from office block to office block, perhaps security personnel. I think this has been recognised by the UK regulator with the recent changes to the personal protective equipment regulations, which has brought in this idea of a responsibility for dependent contractors. But I think they are often the people that are missed, particularly lone workers, people working remotely. I can think of clients who have engineers that go out to repair tractors in the middle of a field. They're rarely in the office. They're often out on site, and it's very easy to overlook these people and not consider the challenges they have from a security point of view, a travel point of view, a communication point of view. And I think they're very much hidden. And add to that the sort of the gig economy where people are not coming to a centralized place. You know, it's very easy to see how individuals can become very isolated, and their health and safety and well-being is not always obvious for the people who are running the business from a central point, because they're always out on the road. And I very much agree this is an area that we should be addressing. Thank you, Sally.
I think this is a good point to remind everybody that the organisation is responsible for anybody who works for them. Anybody doing any kind of work under any kind of situation, you do have a responsibility. And it is not too hard to do a risk assessment for somebody who's not working on site. It might be a different set of questions. You might not have the same controls, but you can do something and you can help protect those workers. I want to focus now, Elizabeth, on gender. We know from recent ISO research that the needs of women and girls across the world are often neglected when it comes to occupational health and safety. And of course, gender is more complex than that still, but this is not a minority group. Women and girls, half the population, biologically speaking. Can you talk a little bit about what that means? What kind of things are getting overlooked?
Well, Sally, I guess I'd say in the last 15 years or so, we have about 50% of the population that have women and girls working in the workforce. So it's pretty split 50-50 between men and women. And working conditions are generally our source of hazards for both men and women. We know that. but how the work is separated out or allocated is usually as a result of traditional cultural assumptions of what a woman can do and what a man can do. And many of us understand when we say, why is a bag of cement the same? Why is it comfortable for a man to lift and hold, but not for a woman? Or why does a brick fit snugly into a man's hand but not a woman's hand? So these are all traditional products designed as a result of the male population. So it's just something to think about it. But we know too that from the design of workplaces, machine design is generally designed around data based on the male population. So this results in problems for women and girls. And also how many of us have had problems wearing personal protective equipment because of our size, our height, our stature, our ethnicity. So all of these things are something that we need to think about in the workplace if we have women and girls working in it. We know too that, for example, women that work in agriculture, they have a high incidence of injuries and disease and very poor support from the health service, and heavy work during crop cultivation and harvesting can have high incidence of stillbirths and premature births and so on. So it's really important that organizations think about this. Again, we know that, for example, in the health service, I think it was Nick referred to the health service and yourself, Sally, we have lots of issues around physical and psychological risks in the workplace that need to be taken into account when you have women working in particular aspects of the environment. And it's really interesting to see too that ISO 26000 has attempted to deal with organizations taking responsibility about the empowerment of women and their equity in society. Thanks, Sally.
Elizabeth, you've been in standards too long. You're talking in numbers.
I'm sorry, I do apologize.
So ISO 26000 is social responsibility guidance. So again, another one worth looking at. But audience, please stop us if we do this to you and you don't know what we're talking about. It's very easily done when we live in this world. But I just wanted to build on some of the things you were saying there, Elizabeth, because we're also getting more and more information, I think, about the effect on fertility health of shift working and the disproportionate levels of women and girls who have caring responsibilities outside of the home. So need different kind of adjustments in the workforce or expectations, have different expectations of what their organisation should be doing to support them to do their job properly. And also, of course, it isn't just gender that affects PPE. The classic model of PPE is based on a Northern European male with a Northern European stature. That doesn't fit a lot of the world's men as well as a lot of the world's women. This inclusivity piece is very broad, and I think we really need to understand that this isn't a case of being politically correct. This is a case where it has practical implications, and if you do not take care of it, you're putting your business at risk as well as your workers, because people will get injured and people will get hurt. And you know, Nick, from a psychological health and well-being point of view, who are the types of workers you worry will be neglected? What are the kind of issues you think get overlooked?
Oh, crikey, so that's a big one.
Briefly.
Do you know what? I would actually go on something that sprung to my mind when Elizabeth was talking, and rightly so, about the female side of it. I think males in the workplace, when we're talking about mental ill health, and we were looking at stigma, preconditioned cultures, etc. You know, guys stereotypically don't come forward. They don't talk about mental health. They don't trust HR, and especially some of the procedures that are put in place actually don't help guys either. You know, society has an expectation of a male to be strong and to be able to take daily pressures and to, you know, be that rock. So even when the guys themselves are trying to, you know, ask for help and gain help with their mental health, etc., society with the preconditioned cultures expect it of us. So you find it really difficult then of what are you supposed to be? What does it mean to be a male in the 21st century? You know, I think the people you need to keep an eye on in the workplace are those who don't have much resilience, maybe, who've got a lot of stuff going on, who've got so many variable factors in their life, working too many hours, who, you know, we're supposed to have a full support system in place with family, friends, hobbies, all this kind of stuff. And if you know that some of your staff don't have that, they live alone, they don't have much family, they're not in a relationship, they just about manage financially, then I would say, you know, to keep an eye on them basically and check that things are all right. But the whole thing with diversity is just how diverse we are now, which on one side is brilliant and should be celebrated for people to understand who they are as an individual. But again, there's that word, being an individual. So then how do you write all the right kind of standards in such a diverse world? Does that answer the question?
Kind of, sort of, but we're going to look at why people aren't taken into account a bit more in a moment. But you've just brought something into my head, and it kind of fits with a comment that's been made by one of our attendees, that add-on measures will never be sufficient to make a workplace psychologically safe. And the hardest part is reviewing the work itself and redesigning it for the health of workers. We can't just plaster over the cracks, we need to dismantle. And I think it's really worth mentioning that ISO 45003, the psychological health standard, absolutely focuses on root causes and what the organisation can do. It's not about personal resilience. You know, if we're asking people to be resilient, generally we've messed something up in the first place, because you shouldn't need to be resilient. You're absolutely right, Nick. There are situations external to work which we have no control over, an organisation has no control over, and you may need a level of personal resilience to deal with loneliness or illness or caring responsibilities, or there's many things outside of the organisation's control. But the organisation can take care to make sure we don't overload people with work hours, with not being unreasonable in our expectations, not allowing bullying or harassment or discrimination. So it's a balancing act, isn't it? Because we're always going to bring ourselves to work with whatever's going on in our lives, but work should be managing how work is organised in the work environment. So we're not making people worse. It should be a safe space. It should be a healthy space. Would you agree?
Yeah, absolutely.
Chatting on mute again. Let's have a look at why some people are overlooked and just explore that a little bit more. Elizabeth, the people responsible for implementing OH&S management systems or looking after OH&S in organisations often represent the traditional majority of that workforce. Is that a problem in itself?
I would say that is the root cause for a lot of problems, Sally. it's even a root cause, not digressing at all, but it's a root cause for the take up and use and implementation of OSAS or 45001 in an organization. So yes, typically in an organization we'll have a representative from the various departments, usually by department actually, or by sections of the factory floor, or the transport area, or so on, and they don't think outside the box. So this lends itself to lots of problems, and that needs to be changed. We need a top-down, bottom-up approach where the organisation, top management understand the diversity of the workforce and what does that mean. And again, it goes back to an earlier question we had discussed about improving the language and the guidance within 45001 of how this can be done. And maybe to some of the points Mike made earlier about the number of the value of having 45001, that you can increase your profits, reduce your accidents and incidents. So this is all really, really important. And it goes back to an earlier point I made. We need to have a diverse group of people on all of the committees, on the implementation groups. We need to have people with disabilities. We need people that represent cognitive disabilities, visual impairment, motor disability, mobility impairment. We need to be able to have people of diverse gender identity on these committees, to help doing risk assessments and to help deal with long-term corrective action through our health and safety committees and corrective action systems, just as an example. But I hope I didn't digress too much from what you're saying, what you asked me, Sally, but that's the fundamental problem. Is we have a standardized approach to having a committee within an organisation that's going to implement 45001 or other management systems, and we have to get away from that. Thank you.
Thanks, Elizabeth. And it's difficult to look beyond your own experience, isn't it? It's difficult to see the world through somebody else's eyes, walk in somebody else's shoes. And you know, when we're talking about diversity and inclusion, we also need to think about race. We need to think about culture. It's not, you know, Nick, I'm picking on you, and I don't mean to pick on you because you're fabulous. But if you go into an organisation, people will see your wheelchair and they'll go, oh, man, in wheelchair, and you've ticked some boxes. But that isn't who you are. You're bigger than that. You're more than that. So is this
picking on my weight?
No, I'm not picking on your weight. I meant as a human being, your spirit, my dear. So I'm talking about intersectionality. I'm talking about, you know, there is more than one thing going on with anybody. You know, I'm not just a woman of a certain age. I also have other stuff going on that people won't necessarily see, which comes back to Elizabeth's point about including more people, more consultation, participation. Do you think that helps with getting that intersectionality point across and gets it taken into account?
Yeah, I think so. You know, you're absolutely right in what you say. I am not my wheelchair. I initially used to introduce myself as Nick Wilson with a PTSD. I'm Nick Wilson. I've got PTSD and a spinal injury. So I used to actually introduce myself as that, until someone said to me, no, you're not your illness. You are you as a person. And I think there's still a lot in society. People, when you look at the higher end of mental illness, even mental health generally, but especially physical disabilities, people still don't really know what to do with themselves. For example, if you go to help a disabled person with a wheelchair, most of them actually don't really want your help because they want to be able to do it themselves. You know, they don't want that control taken away, which is why I was going back to what I was saying earlier on about actually speaking to these individuals, including them in this kind of process. When I speak to workplaces about mental health, it's very much ask your employees what they think should be implemented and what they think should be done and what do they think what would they like to see within the workplace. And when you start having this communication and collaboration, including everyone within the workplace, you also learn about different things. You learn about what they can do and what they can't do. I do a lot around mental illness and how just because you've got a mental illness, it doesn't mean that you don't have any strengths, any strengths anymore. You have different abilities. And so as a manager, identifying what different abilities you've got, someone with PTSD like I have, I've got PTSD, post-traumatic stress disorder and depression, but I'm still a very successful public speaker. There's things that I can do. Obviously, I can't do the army stuff anymore, and that's not me. But someone else, I think it was Elizabeth, who said about thinking outside the box. If we really want to be diverse and inclusive, we kind of need to have open mindsets. You know, not fixed minds. We need to have an open mindset and include everybody in the conversation, because that's the only way that we're really going to be able to understand the needs, wants, requirements of everyone in the workplace.
Thanks, Nick. Yeah, you're absolutely right. And, Anne, I think you've already mentioned that there was a lot of anxiety with people returning to the workplace and that kind of thing post-pandemic. And of course, for a lot of people, they still haven't returned to a workplace. It's still going on. So, as we adjust to a new way of working, a new normal, as people often call it, we've already talked about how people slip through the cracks, the people who aren't in a physical workplace, the security workers, the cleaners, the night shift, whatever. Is there a concern that as we sort of sit there smugly and go, oh, we've adapted to this new world, we again miss groups of people? And what do you think organisations can do to make sure that doesn't happen?
Well, I think it's very easy, Sally, as you say, to be out of sight, out of mind. But I think it comes down to management making a real effort, as Nick has alluded to sort of think outside the box and look at their employees and what they're doing and where they're working. I mean, we've got an issue with this transition to hybrid working, and I think it's going to require people to get the skills and the knowledge to be able to assess their employees and look at the situation in a different way. So I would say that the focus really has to be on training and awareness and understanding of this huge diversity of employees and contract workers, and getting a good understanding of the challenges they face. Because if you don't engage, if you don't involve them, you can easily see a situation would arise where their requirements are overlooked. And it really comes down to the word communication, and feedback. And I'd say not to neglect the skills training of the people at the front line, because at the end of the day, if they are on their own facing a situation, the skills and training that you give them to help them, it is the sort of the last line of defense. So I would always say that if you can focus on skills, training, awareness and communication, you're doing a lot to address perhaps some of these feelings of isolation and lack of involvement. And it's trying to get that productive feedback loop and making a real effort as a line manager to make sure that you leave nobody behind. Thanks, Sally.
Thanks, Anne. I think that's a really good point. And perhaps, Mike, you might want to say a little bit more about how we can include these people, particularly the support staff, the people around the edges, the forgotten people, the invisible people. We had a moment in the pandemic where we all understood how important cleaners were, how important bus drivers were. I think we've forgotten it again. I think we've forgotten it already. I don't think we appreciate our supermarket staff anymore. How would you make sure these support staff that actually they are the essential workers, how do we make sure they're included and protected?
Well, Sally, I couldn't agree with you more that what you called invisible workers, although how much I hate that term, it is very appropriate. So that the cleaners and the caterers and the security people that actually help run our facilities, they are typically not focused on because they're not part of the critical operation of an organization. And the organizations tend to focus on those critical operations first. Okay, and I think that what we have to recognize is that for these ancillary workers, which I think that might be an appropriate term, although I'm not 100% positive. But these workers, we need to understand how to communicate with them. We need to understand that on a macro level, these people that work on these jobs are typically lower paid. Many times they come from underserved populations. Language barriers are abound, and cultural differences are very evident. And so the challenge here is to figure out how to communicate with these people in ways that they will understand in the context of their own language and their own culture. Although otherwise we won't reach them, and we have to reach them. Thank you.
Thanks, Mike. And Nick just sent me a message about, you know, this involves all of us, doesn't it? We're all also responsible for our own health and safety. None of us can expect somebody else, the occupational health and safety rep in the company, to make sure that we're all right. We all have a part to play in this, and it's something we discuss a lot in the technical committee, and it's been discussed in every standard that we have developed, is that this needs to be a whole organisation thing, and each of us as workers in whatever situation, we have a voice, and we have the ability to say, actually, that's a problem. Can we look at it? Or go, Anne, you're a bit quiet today, you okay? And give that peer-to-peer support. You know, this is a big thing. Elizabeth mentioned before, bottom down, no, bottom up, top down, obviously directionally challenged right now. But it is that thing of consultation, participation, but also individual responsibility, isn't it? And I'm not taking away from the need for the organisation, from the decision makers, the people in charge. It's vital top management are involved in this. And Mike, it struck me when you were talking about ancillary workers and lower paid and the rest of it a moment ago, that one of the overlooked groups in the last couple of years have been nurses and care workers. Now, nurses are not low skilled. They are often quite low paid for the work they do, but they have been part of this overlook. People have protected the doctors and forgotten about the nurses. And, you know, it's again, it's perception, isn't it? So, you know, if we can all have a think about it, this is the moment I'm going to come to each of you and ask for some practical advice. I would like you all to think about one thing that you would like an organisation to do today or tomorrow morning that will improve how they act inclusively for occupational health and safety in their organisation. And, you know, because I've known you the longest, Elizabeth, I'm coming to you first because I feel it would be mean to go to anybody else.
Well, thank you, Sally. No matter when you ask that question, it's really, really challenging. So my motto, which I've taken from a number of organizations here in not in Ireland, but in Europe, is it's really important to leave no one behind. So I would practically, that means organizations look at your workforce, look who are there, and see, have you taken them into account when you wrote your policy, put your programs in place, and if you can't decide, well, I don't have time to do that because there's so many, I'd say, well, take one in your office and see, have you addressed that? Have you addressed that person? If it's a person with disability, if it's a person of different race or culture than yourself, or have a look, see how you can address their needs. So that's my first starting point and recommendation. Thank you.
Thank you, Elizabeth. Okay, I'm coming to you, Nick. It's your turn. What one thing would you like people on this call to do when they next go into work to help with making sure that everybody in the organisation is protected in a health and safety sense, physically and mentally?
One thing with 3 titles, that's allowed, isn't it? Of course it is, yeah, of course it is. Education, empowerment, and engagement. They are the 3 things that I would put down, that you want your staff to be engaged, especially with physical, mental disabilities. People want to be empowered. They don't want you to take control. So empower people to do stuff themselves. And yeah, the engaging people, especially with disabilities and who are more diverse maybe than other elements of our culture, to see how what things would make it easier for them or what would help them, and to really engage them within the whole HR process.
So are you saying that a starting point for some of our attendees today could be as simple as just going and having some conversations and listening to people?
Honestly, I've seen it so many times in mental health training that I've done over the past 5 years, that when they literally have those conversations, and instead of just trying to train everyone in mental health and all this kind of stuff, give them the basic knowledge that they need. But yeah, as soon as you start engaging with them, and don't just do surveys, but actually speak to people, you know, and find, we've said it a lot, haven't we, Elizabeth? Think outside the box. I think Aaron said it before as well. Think outside the box. How can we engage to really get them on board? I think you'll learn a lot.
I'm going to say, listen, don't just talk. Where we often have health and safety professionals or senior managers who think they know best. But obviously, you know, they are individuals. You are individuals. Their workers are individuals. We don't all know best about each other. It's that one mouth, 2 ears. Do twice as much listening. Okay, thank you, Nick. That's great. I'm going to come to you, Mike, now. What's one thing you would like to see organisations do, our attendees do, when they go back into work tomorrow to make sure no worker gets left behind?
Well, thank you, Sally. My observations here are to focus on leadership. Implementing an occupational health and safety management system is primarily a leadership challenge. And leadership is based on understanding those you're trying to lead. And that means all of the people you're trying to lead. Okay, so what Nick just said about listening is really important. Good leaders understand body language. Good leaders understand when people are uncomfortable based on how they look in addition to what they say. Okay, so I caution people, and my advice is to focus on leadership rather than trying to manage workers' behavior. And what I think is really important is what you do is vastly more important than what you say.
Oh, that's a big one, isn't it, Mike?
Isn't it though?
Let's not just talk about how important we all are. Prove it to me. Do something about it. It's back to the whole conversation we've had many times in sessions like this about organisations that feel they have ticked the wellbeing box because they've put on a yoga class and given everybody some free fruit. Cherries on cakes. Bake the cake. Give me a cake first.
Yes, absolutely.
Anne, what would your one piece of advice, your one takeaway be?
Sally, it's quite tough to go last when everybody's given the brilliant ideas. So I'm going to take it back again to a very simple level and say, put on your safety gear, go out to the front line to see one of those workers that is perhaps not in the mainstream that you've identified, and just watch what they do. Don't interfere. We've had the communication, but observe, because one of the most valuable things is standing back and actually watching what people do. The conversations and everything will follow from that, but not enough people go and quietly observe what's being done. And that's where things are not done right, people are not involved. So I would say we've kind of done the full gamut from be the leader, listen, communicate, and I would say be the observer sometimes, quietly, a bit like undercover boss, but undercover health and safety person or undercover observer, and look what actually happens.
Yeah, it's a really good point, Anne. I just want to come back to Elizabeth a little bit, because obviously in developing ISO 45001, we had ILO working with us who made sure that we didn't forget the importance of what worker participation in decision making. And I just wondered if you wanted to say something about that and about it needing to be meaningful.
Yes, Sally, and I think this is a really important point to discuss now. After hearing what Mike and Nick said about what's key, what they would see as important, worker participation, and actually listening to work, getting them involved, listening to what they're saying, and then responding to that and doing something about it is so important. And I think it's really important to have a number, what do we call them, focus groups. So we look at capturing all the different needs of people, the diversity of the workplace, of the population within the workplace. So really people on the call today that have organizations, have businesses, even if it's only 3 people in it, it's really important to have worker participation, and they feel involved, they feel engaged, and they will help improve the health and safety within the organization because they're part of it and they have ownership, and it's so important. Thanks, Sally, for giving me the opportunity to talk on that.
Oh, my pleasure. It's massively important, and it comes back to Mike's point, doesn't it, about taking action, not just talking about it. And it's this consultation's got to be meaningful. Don't consult your workers after you've decided what you're going to do and after you've decided what the hazards are. It's just pointless, and actually it has the counter effect, because you're losing trust when you do that to people. Whereas if you actually observe and listen, and then engage in that conversation before you make the decisions, so you make the decisions together, do you know what? Your workers are more likely to follow your health and safety rules because they were their ideas. They relate to what they see as an issue. I mean, it's not rocket science, and yet so many organisations forget. They think it's more expedient to just put some rules in place. But actually, in the long term, does it work? Not so well. Not so well. Okay, we are beginning to run out of time. I have one question which I haven't raised yet, which I'm going to give to Anne. Anne, you may not be able to answer it, so it's fine if you can't. For a number of years, the HSE in the UK, actually, Nick, you may have a view, I don't know. The HSE, the UK regulator, has focused on stress, but other psychological issues have almost been ignored. Does the regulator need to broaden its perspective in line with 45,001 and 45,003? Okay, we have a visual answer. Do you want to say something, Nick, before I come to Anne?
No,
Go
'cause
ahead,
I don't
Nick.
think it will be very PC. Just yes, they do. Basically, you know, there's so much about mental illness, and stress is a really very small part. I just wish that they would get more involved in it. I'll keep it as that because I'll get on a soapbox and be off on one.
Okay, fair enough. Anne, do you have anything to add?
Well, I would just say it's one of those things where it takes a long time, it seems sometimes, to get from knowledge to get to guidance and regulation. Because as I think Nick has pointed out, there's a lot of complexities involved. And it must be quite hard as a regulator to try and encompass everything into a set of regulations or guidance. So I think it will come, and it should come, but it is going to take a period of time. Those are my thoughts.
Yeah, and I would just like to reassure our attendee who asked the question, because the HSE was actively involved in developing 45,001 and hugely involved in developing ISO 45,003. And actually, one of the chief psychologists from the HSE is one of our real advocates for ISO 45,003 and travels around the country talking about it and promoting it all the time. So things are shifting in HSE. Legislation can take longer, but I know that it is already changing because my colleague has told me they're going to begin inspecting organisations to see if they are managing psychological health. And it's not just going to be a narrow inspection, it's going to be a broader one because they recognise just how important it is. It's not so much we're going to come and prosecute you if you're not there yet at this stage. It's more a what can we do to support you because you need to be doing this. And I think, you know, that's where we need to be across the world. Some organisations are doing relatively well, other organisations are doing nothing. We all need to raise the bar and get better at it and recognise its importance. And I'm talking too much and we're out of time. But I'd like to thank everybody for joining us today. This webinar will be available on demand, so if you've watched it and you've got anything out of it, share the link with other people, let them see it too. Also, the ISO Technical Committee has a very active website and you can get in touch with us through that anytime you like. We want to talk to you. We want to hear from you. So please do get in touch and come to our other webinars if you're able to tomorrow, looking at evaluation, emerging trends, and the future of our occupational health and safety management standards. We've touched on it today. We're going to look at it in more detail and you'll hear more about some standards that are in development, which may be useful to you. Finally, huge thank you to our panel, to Mike, to Anne, to Nick, and to Elizabeth. Thank you so much for being here. I've really enjoyed the conversation. I hope you have too, and I really hope our attendees have. I hope to see you all again soon. Thanks, everyone.